Senator Murphy.
Thank you very much, Mr. Chairman. First, I just want to understand how unprecedented this moment is and how unprecedented these changes are that are compromising our families and our kids' safety. Just some simple yes and no questions. I think they're yes and no questions. Dr. Monarez, is there any precedent for a new administration dismissing the entirety of the Vaccine Advisory Board and appointing a totally new board?
I have not had any awareness of that happening previously.
Is there any precedent for the CDC director being required to clear personnel and policy decisions with political staff in the way that you were requested?
That has never been my experience.
And is there any precedent for a CDC director to be asked to pre-approve vaccine recommendations without ever having actually seen the recommendations themselves or the medical and scientific evidence backing them up?
I have never experienced that.
You stated in a previous answer to a question that during your August 25th meeting, the secretary referenced that he had spoken to President Trump about his feelings about the childhood vaccine schedule. You testified that he had previewed for you that there were going to be some significant changes coming. Did he give you the impression that the president supported the changes that he was going to be pushing on the child vaccine schedule?
That was the impression that I got. I have no way to substantiate whether the veracity of that.
Your op-ed opens with a harrowing account of the August 8th shooting, and clearly both you, the entire leadership, and the entire building is still reeling from that moment. 180 rounds being fired into the CDC. What a traumatizing event. I want to ask you about your fears, and Dr. Rory, be glad to hear your thoughts as well, for the safety of our personnel at the CDC and the medical profession writ large. If more and more people believe that those that are recommending vaccines for our children and our families are hurting people. Clearly, you have to be unhinged to take a gun and fire it into a medical building. But these conspiracy theories about vaccines and about the people who are recommending vaccines, I fear they come with consequences. Do you fear for the safety of the CDC and of medical personnel if these beliefs about the CDC actually recommending things that hurt people continue to become mainstream?
I do worry about that. I myself was subject to threats, and I am very concerned that the further promulgation of misleading information will undermine not just the safety and health of our children, but it will also exacerbate some of these tensions, the willingness to commit harm if someone is affronted by a belief that the people like us that are trying to help them are actually not trying to help them.
And I would just say it was 500 rounds. It was 180 that hit the building.
180 hit the building.
Now, each bullet was meant for a person. And each of my staff were very traumatized afterwards. I had staff that were covering their kids in the daycare parking lot. There were people that were out at the ride share as bullets were passing over their head. I have many that won't speak about vaccines now and have removed their names off of papers. They don't wish to present publicly anymore because they feel they were personally targeted because of misinformation.
So you know of personnel who now will not put their name behind good science.
Correct.
That they know would protect the health and safety of families and children because of their fear of violence.
Correct, and even at the ACIP meeting, you'll notice we don't have our subject matter experts presenting anymore. It's taken up to a leadership level because we did that to protect our staff and scientists so that they would be disconnected and their names not associated so that they won't be targeted.
Thank you both for your candor today and your service to the country.
Senator